From the Center for Family Health, also one of the sponsors of the Southside Festival. We have Clinic Manager Tracy Van Buskirk and Pediatrics Clinic Supervisor Kellie Simpson. Good morning.
Morning.
Good morning.
Yeah, these guys, you'll have a booth. They usually have a booth.
We do. We'll have a booth.
Awesome. Very good. Great ways to connect with the community out and about.
Yeah, it is. We will be there.
So this summer, you're seeing kids doing the physicals for back to school, for school sports.
Yes, we are. It's definitely a busy time. We also are still doing our promotion. So anyone that comes in ages 10 to 18 that are getting a physical in the month of July get automatically put into a raffle to win a $100 gift card.
That's awesome.
Yeah.
That's awesome. I mean, don't wait. Don't delay. There's so many things to do before school starts. Don't delay.
Right.
You have to run and get the physical.
And it definitely gets busier the closer to school starting.
Right. What age do kids start to need of that physical for sports requirements?
So we encourage physicals yearly for everybody, but middle school and high school ages are going to need the physical for sports.
It's a requirement.
A requirement, yep.
And then for kids, like going to school for the very first time, there's immunizations and things like that required?
Yep, so going into kindergarten, they look for your immunizations to be up to date, but also going into 7th grade, they look for your immunizations to be up to date.
Nice. And you can do all locations, physicals at all locations?
All locations. Our main location, and then we have Parkside Middle School, Jackson High School, Northwest Kidder Middle School, and Northeast Elementary.
Awesome. Now, Tracy, you guys have some new providers joining you. Talk a little bit about who will be joining you.
Well, for Women's Health, which I oversee as well, we have a brand new female OBGYN starting in mid-September, Dr. Wade.
Okay.
So we're always growing. All of our providers will be there, so this will just be an addition, which will open up our schedules more, and we're pretty excited to continue growing.
Yeah.
So. And as far as the pediatricians, Kellie has got a couple we have a couple leaving, and we've got a couple coming in.
Yep, so we have Dr. Hernandez and Dr. Chen who are moving back home, so we do wish them well. But we're excited to have Dr. Singh join us, and she'll be joining us at the end of July. And then Dr. Eldasuki, he's going to be joining us at the end of August.
Wow, that's amazing.
Yeah, pediatrician. So
Yes.
this, I think a lot of people would expect with school-based health centers, you deal with a lot of kids.
Right.
But not just kids, but pediatrics, a big part of the center's practice.
It is.
Very
yes.
big.
How long have you been there?
16 years.
Wow.
Yep. I've worked in pediatrics. I've also worked over at our school health centers, but now I'm back in pediatrics as the supervisor.
Yeah. How do you think kids are doing now? Kind of the pandemic's behind us, all the weird stuff, the starting. Is that our kids seem to be getting back on track?
Yeah, we're definitely getting them back in, getting them back up to date on their vaccines, getting them in for their physicals.
Yeah, and it's not just physical health, it's mental health, another
Absolutely.
big part of the center.
Yes.
How does someone know whether they're in a situation that it's time for them to see, or their parent decides that it's time for the child to see a professional about mental health issues?
Well, hopefully, that there's that relationship there between the parent and the child. A lot of times the providers, our pediatricians, well, all the providers, but pediatricians, especially with the children, recognize something may be off, because we do have children that are there for years and years and years. The child may express something. We have tests that we do every year for the children. If something comes up, we bring our behavioral health consultant in right into the room initially, just to build that relationship, to talk about needs, and then if the parent and or child feel like they need to have something more, they will schedule an appointment, and then they'll make it regular. I do believe they also do them virtually as well, the appointments, if they can't make it in.
It seems like that might be a situation where, a lot of parents sometimes might ignore things like that for a long time, or be in denial. So when the time they finally come to see you, probably an issue has come up.
Yeah, hopefully there's been some discussion there with the parent, but yeah, I think that's a real consideration, as far as the parents don't want to believe that there might be something going on. But the world is kind of crazy, and as an adult, we experience things we need assistance with. So children understand less than we do, and so we want to be available for them.
I've kind of lost track, and I think so many people have, as to what point we are all at with COVID vaccines, but there's still, and I think maybe this fall we'll be getting a new version, a new
Yes.
formula.
Yep, and they've actually simplified it right now. So the one that's out is a bivalent vaccine. If no one or if you haven't started your series yet, you just need one vaccine and then you're done. So previously it was like you needed one, you had to wait 4-8 weeks to get your second one, and then you needed a booster. So now it's simplified, just one vaccine and you're done. And then hopefully this fall they'll be coming out with their new updated one.
You guys see so many kids in our county. Do you have any idea how many kids you see throughout the year?
Gosh. I don't know.
I
A
know
lot.
the total patient visits last time we talked was like over 30,000.
Yeah.
But it's just the impact you have on children in our community, and having the school-based health centers. I mean, that's awesome.
Yeah.
Yeah, we are the largest as far as giving immunizations in Jackson County. So.
Wow. You should do driver training and senior
Driver's
pictures.
training. You should do driver's training for sure.
Yeah.
You have
Yes,
the
my
park-
daughter's getting ready to do segment 2 next week. So.
Okay. Now, will she get her license at 16?
Well, she's 16 now.
Okay.
We started a little bit later, but
Okay.
she will get her license.
Yeah.
Yeah, it just helps me out so much for them. I have 2 older boys,
Yeah.
but to be able to drive. So
Yeah.
I did watch the segment. That's really a low number. When
It
I was
is.
a kid, I was
Yeah.
like licensed as soon as I can get it.
Ready to
Yeah,
go.
as soon as I got it, 16, gone.
Yep.
So.
Yeah.
Well, another thing, the Bridge, Michigan did a report on why kids aren't getting their driver's license. They're scared.
Yeah, they're afraid.
They're afraid.
Yeah.
Right.
That's kind of sad.
Yeah.
Yeah. Very
Yeah, it
sad.
is.
That's a lot. And I think you have to do like 10 hours of night driving with the kid, right?
Yeah, I think
That's
it's
new.
50 hours, 10 of it has to be night, I believe,
Oh, there's
which
fun.
is hard in the summertime, by the way.
Yeah,
Right.
it is. Yeah. Well, there's
Daylight till 10.
Get out of bed. We're going for a ride.
Just check your child's screen time on the iPad, and I bet you can find plenty of hours to complete the driver's training.
Yeah, if you see teenagers with their parents driving around in the middle of the night, they're doing their test.
My cousin got some nighttime hours leaving a wedding with his parents last summer. That was an interesting one. That was fun.
Instant appointments, practically. You could, in some cases, depending on the day, you could end up getting a same-day appointment.
Yep, we do have some same-day appointments. Our school health centers are usually pretty easy to get into same day. But over at the main in our pediatrics department, we do have a handful of same-day appointments available.
Well, you've been there 16 years. What do you like about working at the Center for Family Health?
I love that we reduce the barriers for everyone in our community. We see everyone, whether they have the ability to pay, and it's just reducing the barriers, whether they can get to the appointments, however it is that we can help them to get in to be seen.
Cool.
Yeah, and that really is a message, Tracy, opening the door to healthcare for all.
Yeah, everyone. Yeah, that's makes it very worthwhile. I mean, I've had jobs years ago that it just you wake up, you're excited, you see what you can do, who you can serve. It's a great organization to work for.
Thank you both so much for joining us. We appreciate it. Get those physicals signed up in the month of July and get entered to win a $100 gift card from the Center for Family Health. Tracy Van Buskirk and Kellie Simpson. More of the morning show right after this.